High emergency room utilization. Emergency room visits have been rising among all demographics and populations, which causes conflict within the department and creates crowding issues. The quality of care, affordability, and accessibility is hindered. Our healthcare agency is the National Committee for Quality Assurance, with our key leader being Margaret E. O'Kane. Emergency rooms are responsible for providing care for a bulk of the nation's patients, largely due to their wide range of care abilities and the idea that there is urgent service. It is very common for Americans to frequent the ER, as in 1 in 5 visit each year. 143.5 million ER visits were recorded in 2018, furthermore proving the frequency. ER patient demographics are concentrated in the city and its population. People with a lower socioeconomic status tend to frequent the ER more. 85% of ER visits happen in metropolitan areas. Children are the most common patients, which is an essential reason as to why the ER needs to retain quality of care. And race and sex of a patient also showed a significant role. Looking at the graph on the left, it shows the emergency department visit rates by age group. Most patients are under 1 year old, and 75 and over is the second most common group. In the graph on the right, the ER visit rates by sex and race and ethnicity are shown. Black Americans visit the ER most frequently, and females and males tend to visit at about the same rate. Our agency is the National Committee of Quality Assurance. They began in the early 1990s, and they measured and then now accredited health plans. They were hired by the government to assess and improve the quality of health care, and they maintain the reputation for high ethical standards. The NCQA's mission is to utilize measurements, transparency, and accountability to identify achievements and thus drive change to make improvements. They began in the 1990s by measuring and accrediting health plans, and they strive to achieve quality products and services in an ethical way of business. The NCQA has had many accomplishments. Some include the Healthcare Effectiveness Data and Information Set, which is a benchmark that measures accountability. It's healthcare's most largely utilized tool to improve health across 6 domains of care, which are effectiveness, access and availability, experience, utilization and risk-adjusted utilization, health plan descriptive information, and measures reporting using electronic clinical data systems. Another accomplishment is the Health Plan Accreditation, which is a roadmap of guidelines for health plans to follow for essential quality improvement and measurement through quality, patient satisfaction, and structure and process. And lastly, the patient-centered medical home recognition is a successful medical home care model. Now on to our key leader, Margaret E. O'Kane. She manages problems by maintaining and expanding the HEDIS health assessment tool. She also created the health plan accreditation, and she also established the patient-centered medical home recognition. So she has played a key role in the NCQA. Margaret E. O'Kane portrays many leadership skills, but some are her initiative to address and improve upon an issue. She's also a high achiever, and she's constantly looking for ways to improve. And she also focuses on the vision, which is to save lives by bettering healthcare quality through measurable statistics while saving the country money. Lastly, even though with all the positives, there are some negative traits. Some include her lack of transparency. Since accrediting standards are not made public, it is challenging for healthcare companies to comprehend how they are assessed and how to enhance their performance. She's also been criticized for having a bias in favor of health maintenance organizations.